A 38-year-old woman came in for a pedicure with an interesting detail. This condition is called Syndactyly, which in simple terms means fused toes. In this case, it's mild and doesn't impact her quality of life, but her big toes condition does. Notice that we have onycholysis here, and the nails are too long, and it's precisely because the nails are long that we can see these transverse grooves. This is the result of the long nail plate digging into the side of the shoe. Basically, the nail bunches up like an accordion. It's all quite simple here. There's nowhere for it to grow. It constantly hits the side of the shoe, and because of that, it takes on this accordion-like shape. We'll start by removing the length of the free edge. And for that I'll use straight edge nippers. These are nippers used in pedicures. Ideally, it's good to have this kind of tool at home so you can trim your own nails yourself. In this case, I'm showing how I remove the length of the free edge, and we'll also be cleaning up the onycholysis. I want to say that onycholysis is not always a catastrophe, and basically it's not a disease, it's just a condition. So onycholysis is when the nail separates from the nail bed. Yes, aesthetically it's not pretty, but the unpleasant thing is that all sorts of things can accumulate under this separation. And that's exactly what we're going to clean up right now. I'm going to use a curette to remove all the material under the nail as much as possible. Why am I doing this? I'll show that no matter how hard you try to clean your onycholysis, even with a safe curette like I use, you can't clean it 100%, yet cleaning is still necessary. I'm going to take a bit that looks like a nail head and my favorite Dr. Alex handpiece. I have 50,000 revolutions per minute here, but of course I won't be working at that speed. I usually work at about 20,000. The bit shaped like a nail head is used to make a small cut in our lifting. I do this very carefully, considering that I have a powerful machine and a sharp bit with a blue stripe. The work must be precise, so this is just a demonstration of my work, not instructions to follow. You need training to perform these actions. Many good courses are available, so keep learning. You shouldn't attempt self-treatment or self-medication. I'm showing you the removed piece. This isn't the full cleaning process. We've only taken off the top part. And now we're looking at what we have left. There's something rotten on the bed, as people say, and these are its remains, the remnants of some dirt. In general, all of this, of course, needs to be cleaned up. I know what most people who are watching this video are thinking right now. They're thinking, oh my god, what a nightmare. How could someone let themselves get into such a state? But believe me, this is just an ordinary person. She looks completely normal. In fact, no one is immune to this. Here, the reason is quite simple. Narrow shoes are to blame. Right now I have a pusher, by the way, I'm showing it, which looks a lot like an orange stick. It works perfectly if the cuticle is stuck and you're used to working with an orange stick. Its advantage is that unlike an orange stick, it won't fray. Next, we use foot talc, which we call Podostop. This is probably my favorite product in pedicure among all the products because it works great and has a pleasant scent. We applied it thoroughly, rubbed it in well, and then using a brush, we remove any excess. Next, we use the classic pedicure bit with a red band. This is a bit with a large diameter, and probably it's one of the most convenient for working on feet because it perfectly protects the pterygium, slightly lifts the cuticle, and allows you to work on the side walls. The main point is it lacks a sharp tip so you can't injure your client. I work both in forward and reverse, and in this case my speed is very low. About 15 to 17,000, I recommend using a low speed if you're relatively new to pedicures. But if you're truly a professional and you know your client well, then you can use a higher speed. Of course, the process will go much faster that way, but you also need to understand that at higher speeds, the risk of damaging the nail plate or accidentally going somewhere you shouldn't with the bit increases. And finally, let's move on to working on the thumb, in this case with this bit. I will work on the pterygium, cuticle, and thoroughly clean the nail plate. My aim is to reduce the thickness since the nail is too thick. Its shape and color suggest this, but the nail plate's color isn't always a sign of a problem or attachment. And by the way, for everyone who likes to make diagnoses based on videos or photos, I want to say that only a doctor can make a diagnosis. And only after your client has taken a test, because doing it by eye is useless. After working on the cuticle in forward and reverse, I move on to cleaning the actual onycholysis because before that we were just trimming. And now I'm using this bit that looks like a pear and it has a black ring. This is the coarsest abrasive among the natural diamond bits I use from KMIS, and I want to say that I use this bit to thin out the seam area as much as possible. Next, I take a more precise bit, for example one like a flame with a sharp tip and a blue ring. You can use a green one, I just took the one I had on hand. With this bit, I carefully get under the edge, meaning under the border of the onycholysis, and clean upwards. My task is to work very precisely in such a way as to clean all the edges, because quality cleaning of onycholysis means making this joint disappear completely. To let the onycholysis grow out comfortably and avoid snags, I'll even out the free edge. I use a file for this and we will make a cut. In this case I am using scissors, and my scissors have straight blades, not curved ones. I make a precise cut. And very often people write to me in the comments saying that my pedicures or manicures are somehow not clean enough. I always say people have an Instagram mindset. Not everything you see on social media, especially under macro, should be taken at face value. Often these videos or photos are simply made to sell you courses. I show my work with regular clients, the real everyday life of a nail technician, and I demonstrate how it should actually look. The client's skin may not let you clean everything perfectly at once, and that's not always needed. Most of the time that's actually not normal because the skin perceives it as an attack. The cuticles and folds will grow further. Stories about always needing perfect manicures and pedicures aren't really relevant, because a person will live their life with these hands or feet, and if you overfile in an attempt to smooth things out or cut too much trying to make a super perfect cut, you might end up with a beautiful result and a great photo for your portfolio. But the person will have to live with it afterwards, and you should never forget that. And you also need to remember that after treatment, while the skin is not moisturized and is still dry, it doesn't look like those perfect pictures you see on social media. That's something you need to take into account as well. As for me, after making the cut, I move on to treating the cuticles again. I use this technique very often, and I believe it's the least traumatic and very convenient. Since during the first treatment I didn't go too deep under the cuticle, I did a rough cut next. Now, using the drill, I'll go over everything again to make sure everything is really clean, but still in moderation. I'm also cleaning up the remaining onycholysis a bit, and after that I can move on to buffing. And regarding buffing, I can also say that it's not always possible, especially on the feet, to buff everything completely in a way that's comfortable for the client. Sometimes it happens that you try to buff and realize that you're about to overbuff the cuticle, and it doesn't matter what speed you're using or which bits you're working with. There are just some nuances with the skin, especially if the foot is moist. In our case, that's exactly the situation, and you need to understand that this skin is really thin. At the end, after the treatment, I managed to stop in time without pushing everything to a super perfect result. I'm taking the pad again to remove all the dust, clean everything and moisturize the skin. And now I can finally assess how my treatment actually looks. Everything looks clean and neat, we just need to finish our treatment. For the oil, I'll be using almond oil, but you can use avocado oil, monarda oil, or any other oil you like. Most often I use the sub-series. And I want to say that in this case, the oil is needed first of all to moisturize the skin, and secondly, so that the client can apply this oil at home for self-care and do self-massage. During self-massage, massaging the nail bed and cuticle area naturally increases blood flow. Like the box 126 certainly looks nice. Leukocytic association. By the way, I think it's very cute.